Hello, people, good evening, and how are you all today? So, this is Dr. Beena Wagle, and I'm here with another session of Wednesdays with Dr. Beena Wagle. And the topic that we are going to discuss today is very, very interesting. So, it looks like it's a very rainy day. You can hear the pitter patter and the thundering behind me. It's been raining continuously for 2 days, has made life miserable for a lot of people. So, how are you doing today? I hope you guys are good and healthy and safe. So, first and foremost, before I start the topic, I have started a few minutes early because some of you asked me to do that. So first and foremost, I want to start with a big thank you to all of you who watch me live, who watch the videos, who send me your comments and your valuable suggestions. So I have been going through almost all the emails and all the messages that I have got, and a lot of you had asked for this topic today. So I have a lot of women asking for this topic which we are going to discuss today because it is a very, very common topic, but I'll come to that a little later. The reason I'm talking to you about the suggestions and everything is some of you have been repeatedly asking me, ma'am, why don't you talk about homeopathy? You being a homeopath, you should promote homeopathy. Does homeopathy not have any say in these diseases? Why don't you promote homeopathy? So a lot of people have been asking for this, and though I would not choose to talk or just keep on harping about my own system, but rather tell you about the ailment. But since it is public demand, what I have thought, and after discussing with my team, is that we come to a unique solution. And the solution is that I do a separate video about homeopathy and these ailments. Like suppose if I'm doing the topic today or last topic that we did, so you discuss that topic, say stress, okay? So if we did stress, the homeopathic equation with stress, so the remedies that which will take care of stress, or the homeopathic approach to people going through stress should be put on as a separate video on my YouTube channel. So many of you know the YouTube channel is Dr. Beena Wagle. And from now on, if you want to know about the homeopathic aspect of the topic that has been discussed, kindly look up that video and you will have a more in-depth knowledge about how homeopathy approaches that problem. What are the different homeopathic remedies? Of course, when I say this, I want to make a point that homeopathy is an individualistic remedy and no two people or no two ailments or no two presentations are alike. And due to this, we have a specific remedy for a specific person. So as far as possible, do not try to do over-the-counter medication. Okay. So now coming to today's topic. So what I will do is the link of that particular YouTube video that I would be doing, I will share in the comment section of this one because it is pertaining to this video. So today, if we are going to do PCOS, the remedies for PCODs, the homeopathic approach to PCODs will be put up on the YouTube video, and I will share the link in the comment section. So kindly, in case you are interested and you genuinely want to follow homeopathy, you can go through that. Yeah. So coming to today's topic, what is that one ailment that afflicts a lot of women post diabetes and hypertension? Yeah. So not stress. Stress, so all of us have, men, women alike, but it is PCOS. Okay, or PCOD, like it was called before, polycystic ovarian syndrome or polycystic ovarian disease. Now it's no longer a disease. It's just a combination of number of symptoms, so called a syndrome. Okay, so a lot of people had asked this because it is becoming very, 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 very common, not only with the older generation. The younger generation, 16 years, 17 years, 18 years, 20 years, it's coming down, okay? So a lot of people are concerned, a lot of parents are concerned about their children, a lot of ladies are concerned about their fertility, a lot of couples come in with these problems. So yes, we need to address this issue, and so I've decided to do PCOS today, okay? So how do we define PCO? Okay, so what is the definition of PCO? A polycystic ovarian syndrome is a disorder. First thing, I would like to make it very clear, it's not a disease, it is a disorder, okay? A hormonal disorder, okay, among women of reproductive age group. So it is no longer restricted to, married women or women post delivery. ऐसा कुछ भी नहीं है. It is in the fertile period. So the moment the girl starts getting her menses, okay, from that time till the menses stop, it can be anywhere in this fertile period. Okay. Now what happens is there is an imbalance in the hormones. Okay. So what happens is when there is an imbalance in the hormones, there are more male hormones produced in female bodies. Okay, so instead of following the female pattern, which is menstruation once a month, the female body starts behaving more like a male body. So what are the changes that you will see? Okay, so there are the first and the basic change that most people come with to a doctor is abnormalities in your period or in your menstruation or in your monthly period. Okay, so they will come and they'll say ki oh doctor पाळी बरोबर येत नाही, 2 महिन्यातनं एकदा येते, और they'll say कि भाई बाकी सब तो ठीक है पर इसके पीरियड का सीन कुछ गड़बड़ हो रहा है, महीने में 2 बार आ रहा है डॉक्टर, या फिर बराबर से आता ही नहीं है, या फिर आज आ रहा है फिर 6 महीने बाद आ रहा है. सो पता नहीं क्या प्रॉब्लम है. एंड द मोमेंट there is amenorrhea in a fertile woman, there are a lot of questions which are asked, and these can be very, very stressful for a woman. Okay, so to avoid that stress and to make life easier in general, let's discuss this and let's decode PCOS. Okay, yeah. So the reason now, ab bologe ki ye hormonal change, why did it happen, right? Why did it suddenly happen in a person who was normally menstruating? Okay, now what happens is because of the hormonal change, there is a cyst or a bubble. Okay, I would say a water bubble. The best way to describe a cyst is a bubble filled with liquid. So numerous or a single cyst is formed in the ovary. Now to explain things, the ovaries produce certain hormones at that time of the month, which in turn will work on the uterus and cause shedding of the uterus, that is your menstruation. Now, if there is a cyst present in the ovary is unable to contract and secrete the hormone at that point of time. So because of this, what happens is the uterus doesn't get the message to shed, and the uterus does not shed. So the periods do not come in, okay? Or there is a vague abnormality in the period. So far, is it clear to you? I see a lot of people watching. And I'm very happy that there are males also watching, and it's not restricted only to the females. So far everything good? Can I get a thumbs up from any of you? I see a lot of people here. Hi Rupali. Hi Mansi. Hello Prashant. Siddharth Joshi, hello. Thank you Rupali. Kalpana Iyer ma'am, thank you. Okay, so good to see a lot of you. Chitra Narayan, hello, how are you? Okay, so a couple of my classmates are here, a lot of friends are here, and we are, for the ones who have joined us late, we are talking about PCOS or PCOD, polycystic ovarian disease. Okay, so I'm so happy to see a lot of you on the audience. Okay, so like I said, there is a cyst in the ovary cannot contract, and because the ovary cannot contract, the periods do not come, or there is a lot of variation in this pattern, the normal pattern, okay? Now you'll ask me, what are the, Jai Shri Mohan, hello. So what are the causes of PCOS? Okay. Now there are a lot of categorization of causes that happens here, but most of the times there are two basic categorizations that we can use. One is where the cause is unknown. You suddenly start having this pattern. A lot of people put it up to stress. Okay. Or the other classification is genetic, okay, or environmental. अब आप genetic बोलोगे तो मतलब, you know, it's simply saying that if your mother or somebody in your family had PCOS, then you will also get PCOD. Okay, I do not completely agree with this, but yes, it has been found that there is proclivity if somebody in the family had it prior, okay, especially in your maternal line. Coming to environmental, now this is something that I strongly support, okay, and I think each of us should give it a thought. If you are a woman or if you have a girl child, definitely you should think about these things. Why is it that suddenly there has been a spurt in PCOS? Why was PCOD not there some years back? Okay, so there is a big, there are two groups. So one group says that it is purely because it went undetected, okay, that many ladies had these problems and due to lack of medical facilities or testing, it went undetected, okay. Maybe, we do not know, but what I feel is currently all the food that we consume, okay, all the meats that we consume, all the vegetables and fruits that we consume are artificially made better, okay, so called, they are made artificially to be better, which in turn is done with a lot of hormones, okay, so that the cows produce more milk, they are given hormone injections. So that the poultry is fatter and bigger, they are given hormone injections. So that more eggs are produced, they are given hormone injections. Now, that is not to say that only the non-vegetarians will suffer. The vegetables and fruits, so that the produce is more and it is bigger or more, appealing, a lot of color, a lot of hormone injections are given into everything that we consume. Plus, to add to this, the risk factors are, we have a lot of stress, okay. So nowadays, women are multitasking. They want to become superwoman, okay. So I always question this thing called superwoman. I think there is no woman who is not a superwoman by herself. She does not have to prove that she is perfect. She performs in the, in her professional life also. She comes back and she's a professional. She's a very good mother and she's a very good bahu and she's a very good wife, and yet she looks very good. And so many women ask me this, ma'am, how do you manage? You're a superwoman. And I say, please do not call me a superwoman. It's all about time management. But yes, people do burn out because of this. This creates a lot of stress. And when there is stress triggers off certain hormonal imbalances. PCOS is one of them. Okay. So environmental factors में ये दो चीजें, stress and artificially infused food products. Okay. So also you will see that menarche, that is the time of menstruation in girls, is coming down rapidly. So there was a time when you would, get your menarche at 12 years, 14 years, 15 years. So much so that now it has come down to 8 and 9 years. Okay. So I think it is one of the contributing factors. So consumption of artificially fed and fattened poultry, milk, fruits and processed food contributes majorly to PCOS. This is not me. This is research findings that I am reading. Okay. Okay. Now coming to which other factors will make you more prone to getting PCOS. This is very important, people, because you may eat well, you may eat organic, you may, you may say, okay, I tune off, I don't work after a particular period and I don't get stressed. Very good. But what are the other factors that you should also consider? Okay. So the first and the primary factor which I always tell all my patients of PCOS is obesity. Now, obesity doesn't essentially mean that you need to look obese, okay? So if the consumption of too many fatty products is happening and your levels in the body are already high on fat, okay? Then, I'm sorry, been under the weather a little. Yeah. So if you're already having these kind of problems, then there are more chances of you getting PCOS. So you may look very, proper or in shape, but yet if your fat content in your body is high, then you're more prone to getting PCOS, okay? Sedentary lifestyle. Now this is the bane of our generation. So most of us are into professions where we are sitting for hours together, or physical activity is very less. Now there are people who will counter this and tell me that मैं तो बाहर काम करती हूँ, yes, I'm sitting for 8 hours, but once I'm home, I'm running around, I'm planning the meal, I'm cooking, I'm looking after my child, and having a child is a whole big thing. I agree. But that is something that you do on a regular basis. Your body is used to that activity. So you cannot call it exercise. Okay? So ladies especially, sedentary lifestyle is something that is going to be a major factor, risk factor for you for PCOS. And third, of course, is the family factor. So family history agar hogi, to you're at more risk. Now this is what people say. So what do you do if you have a family history? Yeah, is it 100% sure that if your mother had fibroids, you will get fibroids? No, not always. Yeah, so there are means and techniques that will help you keep it away or keep it at bay. Okay. So far it's clear. Everybody is with me so far. I hope you guys are not bored. It's a medical topic. It's not a mental wellness topic. So I have to be with the facts. Okay. Can I get some thumbs, please? That will tell me that you are listening to me and you're understanding what I'm saying. So I've got Jaideep Dhamnaskar. Hello, Jaideep. Panna Parulekar. Hello, Panna. Lut Karyappa. Nice to see you. Mary. Hi, how are you? Shweta Walke. Shweta Walke has asked me a question. Shweta, I'm going to answer your question at the end of the session. Pakka. Purvi Shroff. Hi, how good to see you. Brushali Nadkarni. Hello, how are you? Okay, so a lot of hearts, a lot of thumbs ups are coming up. Good. So let's continue. Now, why is it so important to know about PCOS? क्यों है इतना जरूरी? PCO होता होगा, किसको क्या पता? पहले जमाने में भी, like there are ladies who come and tell me, कि पहले तो ऐसे चोचले नहीं हुआ करते थे, अभी इतना important क्यों हो गया है? So now again, there are a lot of complications that happen because of PCOS, and if you're better warned about it, then you're better prepared to handle them, right? So I think knowing about this topic is more important than actually fearing it. Okay, so let me just tell you the complications that PCOS can bring to your life. Okay, the first one is type 2 diabetes. Yeah, so type 2 diabetes mein hota kya hai? Type 2 diabetes means if you have PCOD, you are more prone to get type 2 diabetes. Type 2 diabetes expert is with us here, so I will not talk too much about it. But type 2 diabetes there is some pre-existing disease because of which you get diabetes. So PCO is one of those diseases. So ideally, if you do not want to get either PCO or type 2 disease or type 2 diabetes, you have to be aware and be active. Okay. Obesity. Now, obesity triggers PCOS and PCOS trigger obesity. This is a catch-22 situation. Okay. They go hand in hand. Okay. इनका जो साथ है ना बहुत पक्का रहता है. Okay. Heart diseases. Now, people with heart diseases are sure shot, like, if you have PCOS, you will be obese, and if you are obese, you will get, heart diseases. So it's like a vicious circle. Okay, one supports the other, and this one will. Okay, so I think someone is calling to ask me questions. Can you please put the questions in the comment section, and I will definitely answer it once I'm done with the session, or you can call me post this live session, please. Okay, so yeah, the complications we did 3. The first one was type 2 diabetes, second one was obesity, the third one was heart disease, the fourth one, okay, is mood disorders. So a lot of people come with mood swings, a lot of people come with depression, a lot of people come with anxiety disorders. So these are all the mood disorders that will accompany PCOS. Okay, so it's very important that you know why you are having this particular, highs and lows, or people often get misdiagnosed because of this existing condition. Yeah, so endometrial cancers. Okay, now if you have PCOS, you are more prone to get endometrial cancers. Okay, so it's important that we know about this. Also, it causes, low self-esteem in a lot of people. Now, low self-esteem means you start looking at yourself in a very negative light. Now, why does this happen? So, once we come to the symptoms, you will know about it. But what happens is, in this disorder, you tend to develop a lot of, male pattern in the females. So, you start getting facial hair, like around the chin, or in the mustache area, or surrounding the chest and nipple area, around the thighs. So it's very ungainly, that a female, now we have made this prototype that a female should be hairless and smooth, and that's the prototype we have made. So women who have otherwise not had hair, suddenly when they start getting this pattern, it becomes very distressing. Okay, and then they suffer from self-esteem issues. Okay, so there are a lot of these things which are happening in school. Recently, I had a video call with a student, and she told me that her mother actually approached me saying, my daughter is looking a lot. I don't know if she's depressed, and I want to know if you can help her out. So I said, what is the issue? She said, नहीं, मुझे तो कुछ बताती नहीं है, आप बात करके देख लो please. And she was very scared with the current scenario of things and stuff. So I said, no issues, let me speak to the child. And as I normally do with my counseling, we spoke about everything on the big wide earth, and we came to this very disturbing trend among children. And she is unfortunately suffering from PCOS, which I diagnosed thankfully at that time. But she was getting a lot of chin hair, and the boys were calling her, ये तो लड़का है, ये तो सरदार है. They were making fun of her and calling her ladka, and that was playing havoc with her mind. She had started dressing in a very different manner. I wouldn't label it, but she was trying to wear very clothes which would expose more of her body parts, so that they are aware that she's feminine, and they would stop calling her sardar or ladka or ye to sand hai, That is the kind of comments that were hitting this girl, and for no fault of hers, right? Also, she was losing a lot of hair. So, ये टकली हो रही है, ये तो सरदार है, ये मोना सरदार है, it's very derogatory. Now, when you hear it, probably you will find it, it's hurting, right? So, imagine what that person goes through. Okay, so now we'll come to, that's why it's very important that you diagnose this condition, treat this condition, and all these symptoms are completely reversible. Okay, take it from me, they are completely reversible. I have treated number of people with these symptoms. Okay, so let's come to the symptoms now. What are the symptoms? Okay, so the first and foremost, the first symptom that we generally notice is abnormality in the period or your menses. okay, regarding the flow and regarding the appearance. Okay, so what is the change in the flow? The flow either becomes very heavy, okay, and the frequency changes, or it becomes very scanty and it stops altogether, or there is more duration, again the frequency changes. Okay, so the monthly period starts coming once in 2 months, once in 3 months, once in 6 months, or one period twice a month, or very heavy periods, a lot of clots in the flow, a lot of pain. Okay, these are not normal things in that individual. Okay, the next symptom which many women come to is with excessive hair fall. Okay, now when you come with excessive hair fall, the first thing that I try to tell you is there are several reasons for excessive hair fall. It is not always a PCO. Okay, but 90% of the times we have seen that yes, PCOS causes excessive severe hair fall, which does not get corrected despite taking iron or correcting your diet or taking care of your scalp. Now, very important that you do these 3 things before you label it as hormonal. Okay, so excessive hair fall. Also, the hair becomes very brittle, it's very dry, it breaks easily. Okay, it is rough. It's not your normal hair, so the texture of your hair, it changes. Baldness, so you might get bald patches, or you get hirsutism, that is male pattern of hair on the face or the chest or on the body. Okay, so hirsutism means excessive hair on the body, okay, in not normal female pattern. Dysmenorrhea or pelvic pain, you get a lot of pain in the pelvic region. Okay, many women come with this problem that they are having difficulty in conceiving a child. प्रेग्नेंट नहीं हो रहे, शादी को इतने साल हो गए, हम प्रेग्नेंट नहीं हो रहे, डॉक्टर बहुत सब कुछ कर लिया, सब नॉर्मल है, लेकिन बच्चा नहीं हो रहा है. ओके, बच्चा नहीं हो रहा है इज always a bane for a married woman, and then 90% of the time we find out that this person has got PCOS. Okay, now there is this peculiar condition called acanthosis nigricans. Okay, acanthosis nigricans is dark patches. Okay, now these dark patches can happen in the underarm or in the neck region. Okay, so please, if you see anybody having discoloration in and around the neck or in the underarms, do not tell them cosmetic things to do it. Tell them to correct it internally. A lot of you are very influential women, so people come to you for advice. Some of you are in the beauty field, some of you are you have your own fan following. So I essentially feel that you should, of course, help from your own field, but internally this needs to get corrected. Okay, so this is called acanthosis nigricans, and it is a blackish discoloration. Okay, and this happens because the keratinocytes, there is a specific type of cells in the body called keratinocytes. Now these keratinocytes generally give black color to your hair. Okay, so when these become excessive, they start pigmenting your skin. Okay, next, increase in weight, excessive weight gain, and especially in and around the hips and abdomen. Okay, this pattern, the hip and abdomen pattern, is a typical polycystic pattern. Okay, a lot of doctors are here on the panel and they will vouch for it, that they will see patients who come in with this kind of fat pattern, that there's a lot of fat in and around, otherwise the patient is slim. Yeah, so that is a polycystic pattern. And the last symptom, the last symptom, but the most important one, is mood swings. So you will have these days of highs and days of lows, or you will suddenly feel like crying, or you will start feeling lonely, that nobody cares for me, or I don't have anybody to go to, and you might feel alienated, you will feel you will feel very sad, you will feel very down. So there are a lot of ladies who come and they always say कि डॉक्टर सब तो है, घर में सब है, मेरे दोस्त है ये, but I feel very lonely. Okay, so if you are having mood swings, if you are suddenly getting very irritable and angry, if you are lashing out at people, if you feel lonely, please, this is one of the things that you need to consider. Okay. Now, PCOS बोलना बहुत easy है. It's just PCOS, 3 words. Okay. How do you diagnose this? How do you diagnose this? Okay. Now, diagnosis के लिए, first is absence of ovulation. That means your periods will be abnormal. All the rest of these patterns will be there. Besides that, another way to check is abdominal sonography. Okay. Or TRP also, or transvaginal sonography also can be done, but an abdominal sonography is mostly diagnostic. With that, if you want to do a complete check, you can also check for increased androgen levels. Okay. Now, androgen is what makes men men. Okay. Andros, that is male. Okay. So, if the androgen levels are high in a female, all her hormones will go awry. Okay. And these are the symptoms that will come on. So, these are 2 or 3 diagnostic things that we can essentially do for PCOS. Now, we come to the part of treatment. How do we treat PCOS? Okay, this is very important, and it is a many people say that you can't treat PCOS. Okay, I would strongly stand up and say no, PCOS are completely treatable with the right combination of diet, exercise and medicine. PCOS are completely treatable. Okay, so how do you go about? The first, and when we're talking about this, I'm going to talk on a broader spectrum. I am not, playing to my pati, that is my homeopathy. Okay, so I will do that on my channel, and then maybe you can follow up from there. But ideally, the first thing that you need to do is go on a complete nutritive but fat reduced diet. Okay, so when I say diet, essentially I never say a diet which cuts on any food groups. Okay, but reduced fats and sugars will definitely help in PCOS. That's the easiest way to lose weight, because that is the first thing that you need to do for treating PCOD. Okay, so you need to lose weight. Okay, how do you lose weight? One is through the correct diet and being active. You need to exercise. So time and again I have been telling you this, people, that in a day at least half an hour, keep it for yourself. No matter what pattern of exercise you take up, you may take up jogging, you may take up Pilates, you may take up yoga, you may do swimming, you may do walking, whichever suits you is fine. If you cannot take it at one shot, do 15 minutes in the morning, 15 minutes in the evening, that's fine. Okay, but half an hour of exercise per day is essential. Given the lockdown situation, a lot of us are sitting in place for hours on end. Yeah, do not do that. Take a 10-minute break in between. Okay, if simply to get up and go to the loo, do it. Don't hold on till it becomes unbearable and at the end of 2 hours you run to the loo, because it's very important that you stay active. Our bodies are not meant to be sedentary. Okay, we are not furniture, we are living beings. We need to live. Living essentially means we need to be active. Okay, so also traditionally or by the allopathic pattern, what you are given is contraceptive pills or metformin. Okay, so there are different brands that will be advocated by different doctors, and all of them are pretty good. So that is the part where allopathy plays. Whereas we in homeopathy, I will of course say a little about it. What we advise is we constitutionally treat you. Now, constitutional treatment means if you have a growth, we try to find the base reason for you to have the growth, and we try to tackle that reason so that the growth does not recur. Okay, and that which is there does not cause harmful effects. Okay, so that is how PCOS can be completely treated. So let me summarize this. We introduced it, we said that it's the commonest disorder that women face in the fertile period. That is from the time you attain your period till the time you stop getting your period. Okay. So in the fertile period, this is the commonest occurring ailment. PCOS is polycystic ovarian syndrome. It's a collection of symptoms that we put together, and it basically occurs because of hormonal imbalance, which in turn happens because there are small water-filled bubbles in your ovaries. Okay. Now, what causes this? We saw the risk factors, we saw the causes. Okay. Primarily, we saw them as genetic and we saw them as environmental. We also saw that family history is a bigger predilection if you have it. Obesity is another major risk factor, and consumption of hormone fattened or artificially processed foods causes a lot of problems. So we also saw the complications that PCO brings with it, and why we should tackle PCOS when we can, because it brings along with it a lot of complications like type 2 diabetes, heart problems, obesity, mood disorders, endometrial cancers, lowered self-esteem, bullying. Okay. Then we saw the symptoms. The symptoms are abnormal menses with regards to flow and with regards to the appearance of your menses, excessive hair fall, baldness, excessive facial hair, also pelvic pain, dysmenorrhea, difficulty in conceiving in women, acanthosis nigricans, which I explained to you in detail, that is the pigmentation. Also, increase in the weight in and around the tires. We very commonly, the women lingo is, I have tires. Okay. So these tire pattern is a typical PCO pattern. Okay. Also mood swings. Then we saw the diagnostic methods. We said it is a sonography, it's increased androgen levels, and of course no ovulation. The treatment, the first thing that we need to do is lose weight. How do you lose weight? Through diet and through exercise. You can choose your type. And what is the traditional method of treating? The traditional method of treating will be with contraceptive pills or birth control pills and metformin. Okay. Now this has brought me to the end of the topic PCOS from my side. Now I'm going to check the questions that some of you have asked me and the questions that I've been sent on email and messenger. Okay, so let me just go up and see. There was, I think Shweta Walke had asked me a question long back. Ma'am, what medicine should we take? Shweta Walke, now that's a controversial question you're asking me. You're asking a homeopath, so definitely a homeopath will say homeopathy. Okay, I will definitely advocate homeopathy because homeopathy, I will not say allopathy is bad, but again, it is a hormonal preparation. So how long are you going to take it? Okay, whereas in homeopathy, we will treat you based on your constitution, and I have found it very effective till now. But of course, a lot of people will swear by allopathy and the medicine it works. So the choice is entirely yours. You can opt for any of these pathis as long as it tackles your problem. Okay. Let me see who else. Thank you, Panna. She says nice information. Thank you. Hello, Vidyanand. Okay, Shweta says, ma'am, I was suffering from PCOD 2 years back. Now I lost 10 kgs. Oh, congratulations. That is very good, Shweta. I'm sure then your PCOD also would have reduced and you must be fine now. Hello, Shahala. Still sometime have to take medicine for regular cycle. Oh, that is surprising. Maybe, Shweta, you and I should get in touch and we can talk about this in detail. Yeah, because if you still need to take medication for your regular cycle, we need to, we need to investigate what is really going wrong. Yeah. Tushar Jagtap, hello. Purva Kavankar, hello. Hello, Rupa. Rupa Naik Prabhu. Christopher Stephen Verma says, hi Beena, came to hear what you're covering today. Oh my God, it's for women essentially. Stephen Verma, I'm sure you have a lot of women around you. So having the right information will never go in vain. You must listen in. Vidya Baraskar Gokar. Hello, Vidya. Devesh Nimkar. Hello, Devesh. Nazma Sheikh. Hello. Shashank Parab. Seriously, an important topic which has never been addressed in such simple and understandable words. Means a lot to me. Thank you, Shashank Parab. Hello, Rupatai. Hello, Ramnath Raiturkar. Shweta Walke. Can you give me your email? Shweta, definitely what you can do is you can DM me and I'll give you my number. We can talk actually. Okay. So I had somebody who wanted to come on stage with me and who was that? Okay. So a lot of you have been listening in. If you have any questions, please ask and never hesitate to ask me questions because Shweta, I will give you my number, but definitely on my DM. So on Messenger, you can ping me or you can send me a friend request. Like I was saying, you should never hesitate to ask questions because knowledge is always better than ignorance. Okay, so ignorance is bliss, I agree, but it is better to be well informed, and Google is not the best medium, trust me. So if Google gives you in 5 minutes what we have learned in so many years, I think people will stop going to doctors. Okay, right from a simple headache being diagnosed to a tumor and a cancer on Google, please do not Googlify all your information. Panna says, how should one take care that this doesn't happen? Panna, normally it doesn't happen to people. Yeah. So if you are having any of these symptoms, then like we discussed, exercise, a good nutritive diet, as far as possible, trying to have food which is organic or food which has not been enhanced with any kind of supplements is always better. And knowing that we have children, I think our children need to be pushed to be active. Yeah, they are the generation next or generation X, which is constantly on the mobile phone, iPad, and I don't know what other things. But with that, like I tell many of my patients or my daughter herself that we are a generation which is being blessed and cursed at the same time. Technology is a blessing for you, but with it brings a curse, that is obesity. So even if you are playing your whatever games or if you're chatting, walk around and chat. So that much of activity is also enough. So it's very important that the youngsters or the ladies are active. Okay. So do not fear the ailment. You need to be informed and you need to be aware of things just in case. Okay. Nilanjana Mitra, what are the symptoms? Nilanjana, I guess you joined us late. Yes, the symptoms have been taken up in lot of detail, but the primary symptom is menstrual abnormality, and remaining are hair fall and weight gain and mood swings. And see, it's like, I know it pat because this is such a common disorder. It's so frequent in our practice nowadays that anybody can blindly diagnose, okay, this is a hormonal disorder. So yeah, difficulty in conceiving children, weight gain, hair loss, pigmentation, male pattern of hair on the face, all these things are the symptoms. Any more questions, or should I take up the 2 questions that I have with me? Maybe I'll take up those questions and you guys can send your questions on the comments. Yeah. So there is this lady who has asked this question. She says, I'm 32 years old. I have not yet conceived. The doctors say there is nothing wrong with me. My sonography does not show polycystic ovarian disease, but I do have male hair on the chin. Do I suffer from PCOS? Can you confirm for me? Oh, this is a difficult, that's a difficult thing to do online or virtually. But I think sometimes what happens is your hormones are not what they should be. It may not essentially be a PCO. It may be a pre-PCO condition. So what you need to do is maybe get in touch with a gynac or a homeopath and go along with your reports and your, many of us can diagnose on your body type. And if you are in the pre-hormonal condition also, lot of times medicines will help you. Yeah, so I think it's high time you connect with one of us. Yeah. That was Tara. Tara, I hope you're listening in and you get my answers. This is a mother. She's asking about her daughter. So she says, my daughter gets her periods very infrequently and there is a lot of pain and clots. Also, she's losing a lot of hair. Is it PCOS? Okay, so I don't know how old your daughter is, but you said that she has started getting her period, so I presume she's very young. And when you see this pattern of hair loss happens because of a lot of reasons. If it's a teenager, generally they are very conscious about their body, so they cut down on their food, they don't eat proper nutrients, and they have their own ideas of diets. So check the hemoglobin level. That is the first thing that you need to consider, because lack of iron also will give you hair fall. Also check the liver function if that is normal. Regarding her periods, at this age there is a lot of fluctuation. If she's a teenager, there is a lot of fluctuation in the beginning years, but as I think as you're concerned about it, you should talk to your gynecologist, get her checked up, and if there's nothing wrong, no need to fear. Regarding the clots, yes, I think that is a concern. You need to assure her that everything is right in the first place. Secondly, see that she's active, and thirdly, see that her nutrition is right. Okay. Also try to find out if there is any cause of stress for her. So if all these things are taken care of, I think she should be fine. And if, like you asked, can I help? I can definitely help. Since you already know my number and you ping me, do get in touch. And yes, I would love to help out with your daughter. Okay, I think some other questions have been sent. So let me just... Are the symptoms similar to menopause? Yeah, many a times they are, they are mixed up. People get confused with menopause and PCOS. But I think the fertile age period, that is more diagnostic when it comes to PCOS. Okay. That was Nilanjana Mitra. She says, I am 47. I have children and now things are a bit topsy-turvy. So yes, Nilanjana, I am a homeopathic doctor. At 47, if things are a little topsy-turvy, it could be your perimenopausal, you're closer to your menopause. So it could be that. I think that you should consult your gynac, talk to your gynac, and if that doesn't help, and if you want to consult me, definitely we can get in touch and talk about it, right? So, Panna, okay, thank you so much, Panna. So I think that is it. Let me just check. I hope I haven't missed out any questions. If I do miss out your question, I will definitely answer your questions later on in the comments. Okay. So people, I always say that, the woman of the house is the most, is the foundation of the house. So I think that ladies, take care of yourselves, give yourselves some love and affection. We always give it to the rest of the family. And if you do find any of these symptoms, do get in touch. Also, if you want to know the homeopathic approach, I will be posting a video, I think very soon on my YouTube channel, Dr. Beena Wagle. So do check out that. I will post the link in the comments. And in case any of you wants to approach me, you can ping me on Messenger, or yeah, Nilanjana, you can ping me on Messenger. Yeah, I am Dr. Beena Wagle, and on FB you will see me as Beena Wagle. Yeah, I'll send you my number in case you want to get in touch. So here's to healthy, happy, and healthy, happy, and I would say supportive females, because that's what we do all our lives. So feel free to ask any questions regarding this in the comment section. Even later, if you watch the video, I will definitely answer your questions. Much love to all of you. Take care, be safe, and I love you. Thank you.